Thank you, Governor. Good afternoon, everyone. Thank you for joining us today. I'm going to get started with the data. We have 27 new cases to report today. There are 69 people currently hospitalized. 11 people are in the intensive care unit, and 11 people are on a ventilator in those ICUs. Sadly, we have 6 new COVID-19 associated fatalities to report for today. One person was in their 40s. Unfortunately, this was a person that had a number of significant underlying medical conditions. 2 people were in their 60s. 1 person was in their 70s. 1 person was in their 80s. And 1 person was in their 90s. I would just ask everyone to please consider taking a moment at some point today to remember all the beloved Rhode Islanders who have passed over the last several months. In terms of the data plan for the next few days, we will be updating the numbers on our dashboard on Thursday and Friday, and then again on Tuesday. We have been in the rhythm of updating our COVID-19 data Monday through Friday, but we're going to give our data team a little time off, a well-deserved rest on Monday in observance of the 4th of July. As is the case every weekend, we will be watching the numbers closely, but because we won't have our full data team working over the long weekend, we are going to update our dashboard next on Tuesday after that. While I'm on the topic of the holiday weekend, I want to echo the governor in urging everyone to please be responsible this weekend. The advantage we have as Rhode Islanders is that we know what to do. We saw many states experience a spike in cases tied to increased socializing and gathering on Memorial Day. And then after that, bump 2 weeks after the holidays, the numbers in many of those states have continued to increase and climb from there. We can avoid that. We have the tools. We know what to do. We need people to make the right decisions this weekend and encourage those around you to do the same. That's how we continue to build the momentum of our strong progress. Make sure that you're staying home if you're sick, your loved ones and your friends are. Make sure that you're wearing your face cloth covering or your mask. Use phrases, think about it. When in doubt, put it on. If you have to ask, wear your mask. What are ways to help you remember to do that? Wash your hands regularly. Practice social distancing. Maintain that 6 feet distance and think creatively of how else you can do that. If you have chairs that are being arranged outdoors, mark them so that they're a distance apart. If people are going to be standing somewhere, place tape and markers on places to help everyone remember this. Let's shift our culture together to apply these very simple rules. Keep your groups consistent and small. We know that bringing together larger groups of people greatly increases the risk of transmission of this virus. Pay attention to where you are. Keep the groups of people that you are with small. And then limit contact with commonly touched surfaces or shared items. There are different ways you can think about implementing that. Work on that together. Let's focus this weekend, as the governor said, on enjoying yourself, but doing it safely, simply by following the rules. The best way to keep yourself and your loved ones safe is to keep your group small. Stay close to your household. The reality of this virus is that the fewer groups you are in and the smaller and more consistent your groups, the lower the risk. This goes for people in their 20s, which we especially want to hear and understand this, as well as people in all age categories. We need everyone to do their part. When it comes to face cloth coverings And masks, I'm happy to echo what the governor said, in that cities and towns are absolutely trying to do their part. We as a state have worked with the Federal Emergency Management Agency, or FEMA, as well as with the United States Department of Health and Human Services to be aggressive in procuring millions of face cloth coverings and masks so that we can be equipped in supporting entities, particularly those that can't go out and buy them on their own or just need that boost to get started. We can work together to make sure everyone in our state has what they need. And the Rhode Island Emergency Management Agency is working to get those masks out into the community, to cities and towns, as have been mentioned, and we anticipate distributing tens of thousands of masks. Our vision is to have these face cloth coverings available at places where people may be this weekend in large numbers. We know that the mask covering your nose and your mouth makes a difference. Everyone should have their own face cloth covering and should bring it with them when they go out. But with tens of thousands more face cloth coverings and masks getting out into the community, we want to make sure that no one has any excuse for not wearing one. This mask distribution effort is a complement to all the work being done throughout our state. Our Rhode Island Emergency Management Agency, our health equity zones, collaboratives throughout the state, and people from our state response are all working to get masks into communities that are hardest hit and everywhere, particularly where there are crowds. The last topic I'll finish today with is on travel. On Monday, the governor and I discussed our approach for travelers to Rhode Islanders and for Rhode Islanders coming back from other places. Online, on our website's homepage, health.ri.gov, or going to health.ri.gov/COVID in the alerts and latest guidance section, we have links to the list of states that you are required to quarantine in Rhode Island for 14 days if you return from because of the higher % positivity of cases in those states. Quarantining, staying at home, monitoring for symptoms, that's the gold standard. It's the best and safest way to protect the people around you. However, as we mentioned on Monday, there is an exception to this requirement for people who get a negative test within 72 hours of their travel here to Rhode Island. If someone does get tested, that person needs to understand that testing is imperfect. As we've been saying, no test is 100% accurate. It is one point in time. If you get a negative test after traveling here, continue to make sure that you wear your face cloth covering or mask regularly. Continue to be vigilant about washing your hands and staying 6 feet apart, and continue to monitor yourself for symptoms. Our 3 most powerful tools in the fight against COVID-19 are that physical distancing, 6 feet apart, wearing your face cloth covering, and washing your hands with soap or sanitizer regularly. We need everyone doing the right thing in these 3 areas, no matter when you were tested or what your result says. That's how we're going to get through this together.